The problem is not today. Actually, the problem is for tomorrow. The diabetic blood pressure and the heart issues in the primary stage doesn't reflect any kind of symptoms. And that is the very important point where we can actually trying to understand the patient physiology. How much deeper way we can understand the patient is directly proportional to how much we can reduce the risk into the future. Now the situation in current scenario, the people those who are having the diabetes, since we are going to be talk about today is a World Diabetic Day, and we have seen the lot of people they frequently not check their blood sugar, they do not take the medicine properly, they do not go for the doctor consultation, they don't understand the risk stage in which risk stage they are right now, and that's become a very problem situation. So these early stages of this diabetic patient gradually convert into the secondary stage, which is like uh, kidney failure, heart attack, stroke. Sometimes the foot, diabetic foot is also condition, retinopathy, neurological problem. There's a nerve damage is also happening, the loss of eyesight. So there is a multi more complication. It's begin from the day one, the moment that you get the diabetes in a very minute scale. But if you're taking certain kind of remedies, like you change your lifestyle, you take the healthy food, you frequently take the medication that is prescribed by the doctors, the chances are very less that you can transform into the future such condition. And the most important thing that we see that the people, even though they are taking the medicine, they do not understand whether this medicine is impacting their health properly in an effective way or not. And the second most important thing, even they are checking their annual health report once in a while, like in a 1 year they are taking only 1 or 2 times, that doesn't going to be add any value. You need to be observe your health in a very close manner. You need to understand your health in a much more deeper way the moment that you get such kind of lifestyle diseases. So that's become a key to understand the future diseases. Right now you can predict the future weather, what is going to be happen into the next 1 days, 2 days, 3 days, what is temperature. It is all about the data analytics. So this technology of this Enigma Cloud Diagnosis, which help the patient to understand their physiology, in which risk state they are right now, and what is the complication it going to be create into the future. So if any patient who is coming with us and they are doing that Enigma Cloud Diagnosis, and we are doing the digital screenings from the day one, we are creating the digital clone for the patient, and after that every interval of time we observe the health. Then after that we can generate a one annual health report. They will help to understand ki, okay, which area I need to work it out, what is the probable condition may arise into the future, so I need to solve it right now. The future identification of diseases, it's all about how much understand the data, that information of the patient right now. From the day one we can begin this thing, and it's a very simple process. So that is why that we are doing with the patients, and this diabetic awareness program that we have created for the patients. So if anybody is interested, any family members they have the diabetic patients or anybody, I feel like they need to initiate at least one time, they wanted to understand these things, at least one time they can go for this checkup.